Now, prison overcrowding is one of the key contributing factors to poor prison conditions around the world. Statistics show that there currently are 11.7 million people behind bars globally, a figure that has increased by 25% since 2000. This then brings challenges such as poor health, inadequate safety and security, as well as inability to invest into rehabilitation and social reintegration of prisoners. Organizations such as Incarceration Nations Network are asking questions about whether prisons are part of a problem or the solution in solving crime. Now, I am joined by Dr. Dreisinger, who is the founder and executive director of INN. Dr. Dreisinger, thank you so much for joining us this evening. Now, one might say, the increase reflects the increase in global population too. Would you say that is fair or too simplistic?
I think it's far too simplistic. What we're seeing all over the world is an increase in crime rates and an increase in incarceration rates, which is evidence that the same old is not working, is not taking us towards a place of safety. And so what we do at INN is move us toward a place of safety, which means moving past this archaic use of prisons and over-reliance on methods of punishment that are not bringing us safe communities.
Let's delve more into that, your views at INN on the prison system being archaic. Give us your reasons behind that and what the alternatives would be.
Well, historically, and I've written a book on global prison systems in which I get into more of the history, but historically prisons are a couple of hundred years old, and they were a radical experiment. And that began in Europe and in the United States, that then became foisted on the rest of the world via colonialism and globalization. And it's really a failed experiment. When we look at the numbers, when we look at crime rates and correlations with prison populations, when we look at recidivism rates, which is the rates at which people go right back into prison after coming out, they are astronomically high. And I often remind people that if any company were run on a 60 to 70% failure rate, which is what recidivism rates generally look like around the world, it would be shut down immediately. And yet we persist in these cycles of harm and these cycles of trauma that are not bringing us safe communities. So as a whole, we need to start thinking about social equity programs. We need to think about opportunities. We especially need to think about education. Education, not incarceration, is a mantra for us at INN, and so we're big believers in access to education as a preventative measure, but also after the fact. And when there are prisons, we strongly support connecting those with educational opportunities, and especially university-level education. And so that's some of the work that we're doing. In addition to focusing on things like restorative justice, reintegration. Reintegration programs are sorely lacking all over the world. And so you have people being warehoused away in traumatic environments and dumped right back into communities where they are legally discriminated against. All of this is a crisis, and we need to address it.
Now, Doctor, when we're looking at, crime is a problem globally, but, just to bring it back home to South Africa, for instance, where we have crime stats that are scary. We've got a murder rate which is highest in the world, where over 80 people are murdered every single day. And with those murders comes families and friends and loved ones who feel they deserve justice. And the prison system was one of the ways that they feel that you remove that kind of person from society, then they won't be able to do that again. And hopefully while they're in prison, there will be rehabilitation programs for them there. I know in South Africa, for instance, there is education available for prisoners to be able to upskill, educate themselves, and come out, with far better skills that they went in with. But going back to my question of justice, what do we say then to those families who have lost loved ones or who have been aggrieved by criminals? What kind of justice will they then be looking at?
So we say to them that you deserve restoration and healing, and that is not what prison systems do for those who are directly impacted. We as an organization are anchored in restorative justice, and restorative justice means centering the survivors of harm when we talk about crime. And the needs of people who have been harmed by crime, by high murder rates around the world are not being met by prisons. There is little to no victim services in almost any country that is bringing these people what they deserve. There is little happening in the space of creating social equity, of addressing the trauma that produces high murder rates to begin with, of addressing the social exclusion that produces violence in communities. And so, generally speaking, also when we talk about crime, the needs of those who have been harmed is not punishment, it's healing. And that's where we need to center our criminal justice systems. And there are loads of academic studies that show us this. We can have lots of conversations with people who've been impacted by violence and crime around the world. And simply locking someone up and throwing away the key is not going to bring them the healing and the restoration that they absolutely deserve. And I should say that all over the world as well, including in South Africa, the opportunities for people to access education and skills and trauma-informed care and accountability, whereby they can take responsibility for any harm that they have caused, are very slim to none, sadly. And so that's another thing that we're working towards in our global work.
Now, at the INN, you've also made mention of success stories, because they are there as well, of, former inmates who have been rehabilitated and managed to accomplish great things in their lives following, good, strict rehabilitation in a prison system. You make mention of somebody like Thulani Ndlovu, who founded an advocacy group for incarcerated people living with HIV. Tell us more about those kinds of case studies.
Absolutely, with pleasure, because I think it's important to focus on solutions and on the positive work and not only critique the system. I'm currently here in South Africa with our Global Freedom Fellows. They are formerly incarcerated leaders from around the world, including 2 from South Africa, Thulani, who you mentioned, and they are, all of them, changing the world in their countries. They're from 16 fellows from 13 countries, doing things like building prison university partnerships, doing powerful reintegration and healing work, addressing trauma through the use of boxing and sport. These are all, or as Thulani is, as you mentioned, doing work in harm reduction when it comes to substances and HIV/AIDS. These are the heroes. These are the voices we need to listen to. They have lived prison, they have survived it, they have endured it, and they are coming out with answers about better ways to do justice that will actually move us toward safer communities, that will move us toward healing. And so we're in South Africa. I'm in South Africa with them for the next 2 weeks, first in Cape Town and then in Johannesburg, as they build together, as they learn best practices from each other, and as they build this movement transnationally. And it's a very exciting program, and I have a lot of optimism that it brings justice not only to South Africa, but to the world.
Well, Dr. Dreisinger, we surely do hope that there will be more Thulani Ndlovus who are produced with innovative ways of rehabilitating prisoners. Thank you so much for joining us this evening and sharing your insights with us.